I was diagnosed with juvenile idiopathic arthritis when I was 3 years old. It was luckily then controlled with just a joint injection, and I was in remission from then until around the age of 10.
Juvenile idiopathic arthritis is a type of childhood onset inflammatory arthritis. What that means is that children experience inflammation where the immune system is active and it results in inflammation occurring within the joints.
It's usually worse in the mornings with things such as stiffness in my joints, with struggling to get up out of chairs and out of bed, and then especially with pain in my hands, such as holding heavier objects and things like that.
One of the biggest challenges actually in the treatment of children and young people with arthritis is achieving early and effective treatment. For that, we need to understand which drugs will work for which child. One of the ways that we're doing that is through the MAP-JAG study, in which we perform synovial tissue biopsies from the lining of the joint and performed under ultrasound guidance so that we can remove small amounts of tissue from the lining of the joint at the same time the child is undergoing a joint injection procedure. We then take those tissue samples away to the lab for analysis to understand what's happening actually within the cells that are present within the lining of that joint, and what that tells us about whether a child will respond to a particular type of treatment or not.
The first medication I was on was methotrexate. However, it managed my condition well, but the side effects meant it wasn't really worth it for me. I'm now on a current medication which is a lot better, doesn't make me sick and things like that.
What's made this now possible is the ability to perform those type of biopsies using an ultrasound to guide exactly where the needle is going.
I think it's really important that the right research goes into making sure that medications are found for people at the right time in their treatment journeys. I'm currently working towards my grade 8 violin exam. With my wrists being painful, I often struggled with until I found the right medication, as it requires a lot of strength and mobility with my hand. It wouldn't have been possible without finding the right medication and managing to get my condition under control.